Hi everyone. We are students of occupational therapy at Milligan College in Johnson City, Tennessee, and this is the third in a series of videos addressing sleep as an occupation. Sleeping patterns change as we age, and fortunately there are many things we can do to respond to these changes. For example, most of us will have difficulty sleeping 8 solid hours, so establishing a sleep routine that includes naps is one way to get around this problem. Make sure your naps are intentional and planned, because if sleeping throughout the day becomes too frequent or inconsistent, it can have serious negative impacts and ruin healthy sleep patterns. On the other hand, staying engaged in activities and active during the day will have the opposite effect, leading to better sleep. Another issue that arises for many people is the need to get up during the night to urinate. Certainly there are things we can do to address that too. Of course, be careful not to drink too much before going to bed, and try to avoid before going to sleep. Does your house have hardwood floors? Only wear non-slip socks to bed, or keep house shoes by your nightstand so you will be less likely to slip and fall while going to the restroom at night. A nightlight may also be helpful, not only because it will help light the way and reduce the chance of falling, but it is also very low light, which is important and optimal for sleeping. It requires no energy nor effort to turn on and off, so that's good too. Other reasons to get up at night can be identified and avoided by keeping all the things you might need right by your bed, in and on your nightstand. So a book, a glass of water, maybe your medications, just things like that can really help you get in bed and stay in bed all night. Keep the lights low, the TV turned off, maybe use white noise like a fan to help you relax. And these are all just simple sleep environment changes that are easy to do and may be very useful.
To build upon the helpful hints already talked about in this video, I hope to offer some simple ways to help you get more comfortable at night. In addition to the natural aging process, there are some conditions that we experience as we age that can make it uncomfortable to sleep at night. Neuropathies such as carpal tunnel syndrome or restless leg syndrome, and even arthritis can make it uncomfortable to sleep at night. So I'm going to show you some basic positioning using pillows that you can incorporate into your sleep hygiene. Alright, so here we'll demonstrate some positions. If you are experiencing arthritis, you can use pillows to support the joints at night. So, and you can just place those pillows underneath those joints. For example, if you have arthritis of the knee, you can just place a pillow underneath to support those joints and take the strain and off of those joints. Another thing you can do if you're experiencing carpal tunnel, you can place pillows underneath the arms to help maintain this neutral position and to keep yourself from pulling the arms into the body that causes additional strain onto those onto the median nerve there. And if I'll help you roll to the side. And for just general alignment principles, if you keep a pillow between the knees and the ankles, that helps keep the spine in a neutral alignment. And then you can even put a pillow over the center here and rest the arm over the top of the pillow so that you keep your chest open instead of closing in and bringing in your body into this flex position that can also cause strain on the joints. Incorporating exercise into your daily routine is a great way to improve your sleep at night. Also, getting outside is important to help regulate your circadian rhythms, which tend to suffer as you get older. In addition, gentle stretches such as yoga or even nerve glides can help ease discomfort before you go to bed. And you can actually check the links in the description below for specific nerve glides for different issues, as well as different yoga poses that you can incorporate to help relax your body and restore some mobility in the joints.
So now we are going to talk about specific orthotics that can help decrease symptoms associated with certain conditions of the wrist and hand. The purpose of these is to help increase sleep quality by taking steps to decrease pain and increase functional use of the hand throughout the day. These orthotics are specific per injury and you should be evaluated by your physician to determine what kind of wrist and hand condition you may have. Additionally, your OT can make these individualized for your hand and will instruct you of a wear schedule and cleaning routine. If the orthotic rubs does not fit properly or swelling occurs, go see your OT to get the proper adjustments made and discontinue use. The first orthotic we're going to talk about is a wrist cock-up splint. So this splint has been modified to be in a neutral wrist position for carpal tunnel injuries. For this is to help you not curl the wrist while you sleep, because when you have carpal tunnel, that causes the medial nerve to become further compressed. So this splint would be worn at night, and you would wear it throughout the night just to keep that from happening. The second splint we're going to talk about is for cubital tunnel pain. So this is what Ben has on here. This splint is specific for the cubital tunnel where the ulnar nerve comes in, and it keeps you from bending that elbow and compressing that nerve to cause tingling throughout the day or when you wake up. So this is a nice functional splint for that use. So this is a resting hand splint. This splint is specific for a lot of different injuries, but for our purposes, we're going to talk about it in relation to rheumatoid arthritis. So with rheumatoid arthritis, as the disease progresses, you can get deformities in the fingers. So while you sleep, this splint is going to keep your hand in a functional position and try to negate those deformities from progressing or becoming an issue. If you have rheumatoid arthritis in both hands, you can rotate this splint per night and switch hands. So you wear it one night on one hand, one night on the other hand. This might also need to be worn during the day depending on how far along your rheumatoid arthritis is, so you can consult your doctor to figure out how often or frequently you need to wear this. So this is the conclusion of our videos. We hope that you've learned a lot about the different ways that OTs can help with sleep and sleep conditions. To find out further areas that occupational therapy can help people with, look at the links below and visit the websites that we have cited in our page. Thank you.